So, getting into you're talking about the garments and the function of the garments. What does it help the body do?
It's like two big purposes. One is, remember, if you're molding an area, if you just think about, let's talk about liposuction. So what you have an area that you did liposuction, so you remove the fat, you scooped the fat out. So now what you have is you have the skin and you have the fascia of the muscle, and then there's a space where the fat used to be. So you want to help the skin shrink and retract to mold to the area that's underneath as much as you can. Of course, it depends on the patient's skin elasticity, right? I mean, that intrinsic capacity of that skin to shrink back. But the only thing that we can do other than praying is adding that external compression
Mm.
and allow that skin to shrink. The second one is, imagine if, let's talk about a facelift. So you lift up the skin, so the skin is floating, and then you want that skin to stick back again to the underlying tissues. So that's why what you need is you need a facial dressing to keep it and allow the undersurface of the skin to get reattached and to stay attached
They're kind of keeping everything together
together.
in its new home. And along that same thought is, and people hate thinking about drains. And it's
Mhm.
more like they hear these stories. I don't want the drains, blah, blah, blah. Drains are really important. Tell us why drains. If your doctor says you need drains in your tummy or your breast or your face, what are they doing and why are they important?
So the goal of the drain is to remove the fluid of that your body's going to try to create. So normally we're not creating additional fluid in that area. So let's go back to the example that I said. You lift up the skin, and so you separate the tissues, right? You separate the skin and the fat from the muscle and the fascia. So you're creating a space that wasn't there before, and then you want that space to collapse. But your body does not like empty spaces or new
Mm.
spaces. So your body says, oh, you know what, let me put some fluid in here. And that's the best solution, or the best way that your body can try to react. So in that new space that you created, the fluid that's being quote unquote accumulated, it's going to be drained by the drain. Your body has the ability to create fluid, put it in an area, and drain it. Your body can get rid of it. But after surgery and after all certain things that we do in certain surgeries, then the capacity of your body to reabsorb that additional fluid is overcome. Then that's the reason why you put in that little tube. And when I say little, imagine it's little in terms of caliber, right? In terms of the caliber, it's little, but it tends to be very long and sits in there. And when we remove it, then patients get surprised. Oh my God, all that was inside. So that's the main mission of the drain. The way they work is they work based not on gravity. It's not a tube that it's like kind of you have to keep down. And remember that all the fluid gets collected in this plastic grenade. But it's not that it works through gravity. It works through negative pressure. So it's also generating internally negative pressure, like a little vacuum in there, which is also helping collapse that tissue. So that's another benefit of having the drain. You can imagine you have like a little suctioning machine inside, and it's allowing your tissue to shrink and collapse. So that's really good.